My name is Trevor. I'll be your nurse today. Let's go over some diet for you. You need adequate nutrition so you and your baby's body can heal. You should eat foods high in fiber such as broccoli, cauliflower, and bran. You should also increase the fiber because it'll help make your bowel movements more regular. Eat foods that are rich in calcium, like leafy green vegetables. Spinach is a great one. Also, any dairy products, milk or yogurt. You should drink plenty of water and any juice that doesn't have any sugar. You should avoid drinks like soft drinks, coffee, tea, and any alcoholic beverages. Let's talk about activity. You should gradually increase your daily activity and rest as needed until you were where you were at before you were pregnant. You should not push, pull, or lift anything heavy for the first 2 to 6 weeks or until instructed by your doctor. Do not drive until your healthcare provider tells you that you are allowed to. All right, let's go over some breast care tips. Your nipples and breasts have changed in size since you started your pregnancy. You're going to want to wear a well-fitted supportive bra both night and day to help you increase your comfort. You want to wear breast pads to catch the leakage, and the leakage may occur several weeks to months after pregnancy. You can apply ice packs for 15 minutes every hour as needed to reduce discomfort. If you weren't breastfeeding, we would want you to wear a well-fitted, tight, supportive bra for at least 3 to 4 days after pregnancy and refrain from any massaging or stimulation of the breast, including a warm shower or any warmth. You can put cold packs on it to reduce any discomfort, and we would want to make sure that you put a barrier in between it in your skin. All right, let's go over some breastfeeding things here. Your baby's mouth has to form a tight seal over the areola and not the nipple, as we are breastfeeding, not nipple feeding. If it does have incorrect latch, just go ahead and put your finger in between the baby's lips and pop the suction. Reposition him and try again. You should feed your baby as much as the baby wants to be fed. Normally it's between 10 and 30 minutes. It is important that you feed out of both breasts to keep your breast healthy. Good signs are the baby is swallowing. It sounds like a little clicking noise. You don't want any dimples in the baby's cheeks. The baby's ears might move, wiggle. And you want to make sure that the baby and you are both calm and relaxed during the feeding times. You should feel a gentle tug at the nipple and no pain, especially after the first few minutes. If you do feel pain, just remember, pop the finger in there, decrease the latch, and reposition him properly. And that way he can go ahead and... All right, let's go over some hygiene. You should wash your hands frequently, and you should always wipe from front to back to prevent infection. You should use a warm tap water Perry bottle every time you defecate or urinate. Change your pads frequently. Bleeding is going to occur. It's going to start out as red, and then it's going to go to a pink, and then a brownish to a yellow or white cream color. Your menstrual period can start at 6 weeks to 2 months after pregnancy. Bowel movements, you want to avoid constipation. Take laxatives or stool softeners to help make your bowel movements more regular. Increase your fluids and your fiber as well. Birth control, discuss this with your healthcare provider. As we said, your menstrual period can come back. Sexual activity, nothing should go in your vagina for up to 6 weeks after. And you want to make sure that before you start sexual intercourse that there's no bleeding and that you're both ready physically and emotionally. Any of the following signs, you're going to want to report them to your healthcare provider immediately. Any pain, redness, warmth, swelling, drainage, or foul-smelling discharge from an incision. Any discharge that is foul-smelling or abnormally colored from the vagina. If you have a severe headache or any blurred vision or vision changes. If you have a temperature of 100.4 degrees Fahrenheit or fever, chills, or you feel cold. If you have any thoughts of harming yourself or the baby. If you have pain or burning sensation, warmth, or swelling in your legs. If your breasts become painful, swollen, hot, red, have spots or streaks, or any flu-like symptoms. If you have any sharp pains in your chest, abdomen, or breast. If you have any trouble breathing, dizziness, or faintness. If you have any crying spells or mood swings that are abnormal. And if you're unable to empty your bladder or your bowel, or it is painful, difficult, or too frequent for your urination. And if you have any difficulty moving bowel movements. For any signs of domestic abuse, you're going to want to call this number on the screen and make sure to tell us. You don't have to tell us around your partner. The baby should always be positioned on their back as safety for sleeping. You should have them in one-piece clothing, no blankets, no loose toys, no stuffed objects, stuffed animals in their bed or their sleeping area at any time. They should be put in the same room as the parents, but not in the same bed as the parents. You should always make sure that the baby is suctioned and bulb syringed in his mouth and nose as needed, as they have some secretions that they might need to clear. You should always clean that bulb syringe with soap and water and allow it to air dry. Hand wash every time you're going to touch the baby. Car seats should be fitted properly to the infant, and by law, you should not put any signs in the front yard that says we have a new baby here, and you should question any unfamiliar people that are coming up to your house, and do not use monitors as you see on TV to reduce the SIDS. You should watch your baby yourself. It's normal for babies to cry, and they might need a diaper change, they might be hungry, they might need to be burped. You should burp them after every feed. Some calming techniques are to put the baby on skin to skin, gently rub their stomach or their back, walk with the infant, rock the infant, go ahead and feed them. You can put a pacifier, but we don't like supplemental devices. If you get frustrated, put the baby in a safe place, call somebody and ask them for help. Sleep patterns, babies like to sleep a lot, so they are going to need to be woken up to be fed at least every 3 to 4 hours during the night and 2 to 3 hours during the day. You need to make sure that they get some tummy time, which is where you put them on their tummy, and then it needs to be supervised so that they can strengthen their neck, their abdomen, and their back. Babies that are being breastfed, you should breastfeed your infant at least 8 to 10 times a day. And anytime that baby wants to feed, you should feed it. Make sure that you're holding it in a proper feeding position. Your infant wants to be cuddled, as we all do, and they need some skin-to-skin time, which is a great time to do it. After feeding, you should hold your infant upright and pat him on the back, over the shoulder, burping him. If your baby's going to be bottle-fed, your neonate's going to receive any infamal diet, and the baby's going to sleep 4 to 5 hours maybe. You need to wake it up and feed it then. You can't forget, the baby should be fed every 3 to 4 hours, and it should be burped every half ounce of formula and at the end of each feeding. You should also cuddle this infant and keep it on skin-to-skin contact. Never prop the bottle up and never heat the bottle in the microwave. You should burp the infant as needed to. A newborn rash is normal. It can appear as small red circles with little white dots in the middle. It does not require treatment. It will resolve within a week of birth. And do not put any lotions, powders, or perfume-scented soaps on there. Milia are these little white bumps that appear on the baby's nose and face, and they will disappear within the first week of life. Please do not pop them. Jaundice is a yellowish tint of the skin. It may appear for the first 24 hours. If it appears for more than 24 hours, you need to report this to your healthcare provider immediately. To bathe your infant, you're going to want to use sponge bath until the cord falls off. You're going to want to use a wet washcloth that's warm. Gently wash your infant's face and then straight down to the toes, saving the perineal or diaper area till last, and then wipe that. You can use a mild infant soap if you need to. Cord care, you should keep the cord clean and dry. You can clean it with soap and water if it ever becomes soiled. You should inspect the cord and make sure that you report any discharge or discoloration, and it'll fall off within 2 weeks of life. You're going to have 1 to 2 wet diapers and dirty diapers for the first 1 to 2 days of life. The first stool is going to be blackish green and sticky. Then you should expect that it's going to have 6 to 8 after 1 to 2 days of life, 3 to 4 days of life. The infant's bowel movements are going to slowly change from a yellowish green to more of a yellowish and cottage cheese-like, maybe even whitish, mustardish consistency. Your infant should have 1 bowel movement every 24 hours. That's a full day. You want to keep a record of your infant's bowel movements and urination habits to make sure that they're properly hydrated and fed. For the female genitalia of your baby, you always want to wipe from front to back to reduce infection. You want to clean all creases and any folds to prevent diaper rash. You want to pat it dry and then replace it with a new diaper. It's normal for the baby girls to have a whitish, pinkish discharge, and it'll go away on its own in time. For the uncircumcised male, you want to wipe from front to back as well. Be sure to clean all creases in any areas, pat the area dry, and then put on the new diaper. For circumcised males, you're going to want to wipe from front to back, clean all folds, pat it dry, put on a new diaper. They might have Vaseline gauze around the circumcision for the first 24 hours after the procedure. The head of the penis will initially appear red, and then it's going to go into a yellowish film-like sticky, which is normal. If you see any bright red bleeding or any green discharge, you should contact the healthcare provider immediately. And there's a plastic ring method of circumcision, and it does not require dressing, and it should come off within 2 weeks. If you notice any swelling, redness, or green drainage or discharge, then you should report this. Contact your healthcare provider. To clean the circumcision, you can just use a wet washcloth and a gauze pad with plain water. You should dress the infant as you would dress yourself after 3 days, as his hypothalamus is working then, and you don't want him to become overheated, so you don't want to wrap them in too many blankets. You want them to get all the vaccinations and be as healthy as possible. Thank you.